Hi, Whole Health Revolutionaries. A long time. I haven't been online for a little bit, but I had a question from a young man called Luca about the effects of e-cigarettes on the body and with the confusion over the stopping of smoking around the world with the replacement of e-cigarettes. It's a very valid question, which is, are e-cigarettes bad for you? And here's the take on e-cigarettes compared to normal cigarettes. The only difference between normal cigarettes and e-cigarettes is that normal smoke-producing cigarettes produce tar, which goes into the lungs and does clog up the lungs, as well as producing atmospheric smoke, which has a secondary impact on other people around and to the environment that you live. Now, as for e-cigarettes, there's this sort of strange knowledge and thought process at the minute that they're good for you, and I see them advertised in all sorts of different flavors, and cherry and blueberry and blackberry, which again is a tool to try and attract the younger generation to begin smoking e-cigarettes, because the presumption and association is that they're not bad for you. Here it is. E-cigarettes, other than the direct damage that normal cigarettes do to the lungs, are just as bad for you as any kind of cigarette, because they're still very high in something called nicotine, which is the stimulant that causes the addiction to cigarettes, be they e-cigarettes or normal cigarettes. Now, as a stimulant, nicotine has a number of effects on the body. One is it causes your adrenaline to go up, and that's going to make your blood thicker. Therefore, your cardiovascular system is going to get compromised and have to work harder as your blood gets thicker and tries to work its way around your body. The second thing is that the micromolecules of nicotine that you inhale are actually sharp-edged. They're not smooth molecules, which means as they pass through your bloodstream, they cut tiny micro cuts within the arterial and venous, so veins and arteries of your body and your heart. Okay. Now these micro abrasions, as we call them, or micro cuts, over time will cause a roughening of the surface of the arterial or venous walls. And what that does is it makes it much easier for the fatty plaque, which we call cholesterol or atherosclerosis, so the fat and calcium deposits that are traveling around our blood system, it makes it easier for those to stick to the sides of your arterial and venous walls, okay? So what that means is the arteries and veins will begin to get clogged up with fat and calcium deposits much more quickly than if you didn't smoke. So even though smoking e-cigarettes won't have the direct impact on your lungs in terms of lung cancer and respiratory disease that regular cigarettes will have, it will still have a very strong impact, negative impact, on your cardiovascular system by causing particularly the smaller arteries around the heart, to clog up with plaque, which is made up of fat, cholesterol and calcium, because the walls of the arteries are going to have become much more roughened and therefore easier for the passing debris to stick to. So you youngsters out there who think that smoking e-cigarettes is cool and fine and tastes like bubble gum, you know what, you're still doing a lot of damage to your health. It'll still slow down your growth and can stunt your growth if you're still growing in terms of height, because of the effect on the cardiovascular and adrenal system, as well as that influence that's going to have on the cortical effect on your body, which affects many more hormones than just your adrenal. It affects hormones in your brain as well, in the hypothalamus. So your whole body will become more acidic and more disease effective should you smoke e-cigarettes. So should you smoke them? What do you think the answer is? What do you think it is? Boom, over and out.